enjoy having a nice smile? Or how many of you enjoy eating your favorite foods and really just savoring that flavor? Or how many of you enjoy, I'm sure you have not thought about this, but having teeth that are sturdy and strong that can enjoy those nice foods? If you can imagine this, there are some people out there that struggle with that, and it hurts and it's painful for them to eat those foods, and it just is a whole wreck. I'm currently a dental assistant at a dental office here in Rexburg, and we've seen a lot of cases of periodontal disease in my office. And basically, periodontal disease is a disease of the gums of your mouth, and it's basically the bacteria that gets underneath your gum tissue from the foods you eat, and it causes an inflammatory response that eats away at the bone tissue and then just causes your teeth to fall out eventually if you don't get it taken care of. So, I know most of you are probably thinking that this disease is found in older people that are about to pass away and die, but it's actually mostly found in, middle-aged people. So 47.2% of adults that are 30 years old or older have some form of this disease, and 30 years old is not very old at all, actually, and that is a really high percentage of people. So knowing that and keeping that in mind, there's a lot of things that you can do to keep that number down. And you can keep that number down by knowing how the bacteria works and how it forms in your mouth, and then knowing how to kind of prevent it, how to clean it out, and how to just take care of it. Also with the use of dental professionals, because no matter how hard you try, there's some things you can't do at home, which is a little upsetting. So now that we talked a little bit about what periodontal disease is, let's look into more of what it actually looks like. So this is the main bacteria that causes periodontal disease. It's Porphyromonas gingivalis. This is kind of a picture of what it looks like microscopically. And if you get in closer, I know you can't see it in this picture, but you've got little finger-like projections. They're called fimbriae. These fimbriae kind of attach together. Think of like some people holding hands in a line. They're pretty strong and they can't really be broken. So this fimbriae, they're really strong. They even live in what we call a slime matrix. And this matrix is made up of proteins, sugars, nucleic acids, and so you can think of that's about the food you eat. And it's really hard to be breaking up because they're an anaerobic bacteria, which means they hate air and water, and so they kind of just sit in there and cause issues. And then this stuff can go ahead and cause infection. There's a picture here. I really like this picture because it's a good visual of what it kind of looks like and where it sits in the mouth. This yellow band right here is kind of where it sits, but it also can go a lot deeper underneath your gum tissue. You've got your gums, and as soon as it goes back right here, there's all this bacteria, and it sits right there under your gum tissue, and it causes it to be really irritated and really inflamed. And your toothbrush and floss can actually only go 3 millimeters underneath your gum tissue to clean it out, and that bacteria goes a lot deeper than that you can reach it. So right here you've got your Porphyromonas gingivalis right there, and it's kind of linked together by that fimbriae. So you can clean out most of the bacteria with your toothbrush, but there's kind of like a wall where you just can't quite get it all out, and that's just over time, it's going to cause issues, eat away your bone and stuff like that. There's a couple other pictures here some signs that you can look for to know what it looks like on yourself so you can see to get help. This right here is a picture of healthy gum tissue and what it should look like average. It's nice and pink, kind of in color. And your gum tissue is really just straight, and we call it in the office knife edge, where it just goes right up to the neck of the tooth, and it's just straight and it flows perfectly with it. The next step here is gingivitis, and just about every adult that comes in for their regular 6-month checkup is going to have some form of gingivitis. It's just a regular buildup that you've got under there that you need to get cleaned out. So you usually should be going back and forth between these first two pictures. But if left untreated, you go to the next step here, which is periodontitis, and you can notice the gum tissue is a lot puffier, it's a lot redder, and the teeth look elongated. And that's because that disease gets under there and it starts to eat away at the bone. And where the bone goes down, the gum tissues follow. As you can imagine, over time, it just keeps going and your teeth can fall out. So this next picture I really like, because it's radiographically, you can see this yellow line here is where this patient's bone level is. And then right here, this arrow is where it should be. So that's quite about, his teeth are falling out. This guy's falling out. I've actually taken some pictures at my office that look just like this, and it's really a sad case because these people can't eat, and it's kind of just, they did it to themselves, one of those things. So now that we've seen what it looks like, how the bacteria works. I want to talk about how to prevent it so you guys don't fall into this trap. So, some ways of prevention is frequent brushing of teeth and flossing of teeth. I'm going to go over how you kind of do that. Use of fluoride is really good to use. Sometimes it's in like the water in your area. And then correct technique. We're also going to talk about that. I know most of you probably think that you're brushing your teeth right, but I bet you're probably not. And then becoming aware of what foods can make this disease more aggressive and larger, and then also the use of using your dentist for traditional cleanings and stuff like that, and the tools they'll use. So let's go over proper techniques of brushing and flossing. This is my favorite picture up here in square one, where it kind of has this lady's toothbrush angled up so you can get underneath the gum tissue a little bit better. If you go straight on, that's just going to scrub off the plaque, but you want to get underneath that gum tissue to kind of clear it all out really well. So half your toothbrush should be on your tooth, half of it should be on your gum tissue, and it should be just like a smooth circular motion, not really hard and aggressive. Then also with flossing, these are good do's and don'ts. Most people, when they floss, they go in and out of the tooth. Get the food out, get out of there. But the best way to do it is to actually go up and underneath the gum tissue, as this has right here. And this flossing mechanically breaks up that biofilm that you've got in there, and it looks like it would be painful, but it's actually not. So you go home and try it and see if you like it. Your teeth will feel a lot cleaner, I promise. So next, let's talk about just some foods that affect it. Like I said, that slime matrix is made up of sugars, proteins, nucleic acids. So of course, a lot of your sodas, you can drink as much as you like, just brush your teeth after. And then a lot of proteins, it's good in your diet, but too much of anything is not good for you. And then I want to talk a little bit about this one. Bread is carbs. I didn't mention carbs, but if you think of it, when you eat bread, it turns into glucose in your mouth, and then which glucose is sugars. So when you take a bite of that white bread sandwich and it gets gummy and it sticks to your teeth, that's fermenting and becoming that sugar that sticks underneath your teeth. So that's the stuff that you need to get cleaned out. And then next here, why to go to the dentist every 6 months, and some tools they use to clean it out. This right here is called a piezon, and it's a tool that kind of vibrates, it sprays water and air, and it goes underneath your gum tissue to really get it to clean out. It, like I said, chews water and air, and it was an anaerobic bacteria, which means it hates water and air. So it breaks it all up, it flushes it all out, and it goes a lot deeper than your regular toothbrush and floss, which is only 3 millimeters. These guys can reach up to like about 10 millimeters or so. Also going to your dentist, this is a normal amount of calculus you have on your teeth. You can go home and just look in the mirror and see if you can see how much buildup you guys have. This is a very average amount to have, and so it's just good to get that stuff bumped off, get it cleaned out. Your gum tissue will love you for it. And then also regular checkups at your dentist to see if make sure there's nothing else crazy going on in there. So, well, now that we've talked about what the bacteria is like and ways to prevent it, I'm sure that the 47.2% of Americans can be brought down with the spread of the awareness of this disease, and that I just urge you guys to reflect on your self-health and see what your future looks like, and hopefully that's enjoying small and simple things. And one of the small and simple things that you can do in life is just sit down and enjoy a meal with your family. So, thanks guys.